Lifeline, the talk show that talks about mental health in Flagler County. Presented as a community service by AdventHealth Palm Coast Foundation. And now, your host, John Subers.
Good morning, I'm John Subers with AdventHealth Palm Coast Foundation, and welcome to Lifeline, a weekly show that addresses mental health here in Flagler County. I'm excited today because I have with me in the studio Wally De Aquino. Wally is the Chief Operating Officer of AdventHealth Palm Coast. Welcome, Wally.
Hello, John. Good to be here. Exciting time for us in Flagler County.
It sure is. A lot of stuff happening in our healthcare world. But Wally, this show, we're 5 or 6 months into it with a mental health focus. You, in December, with David Ayers, were very engaged with mental health in Flagler County and the need of, we have some great support systems, but there's a need and a void in Flagler County, and AdventHealth needed to be a part of, I don't know if solution is the right word, but part of...
Solution is the right word, John.
Okay, there we go.
You got it.
So this show, we've had a lot of experts on, from doctors to psychiatrists to therapists to scientists, about mental health, and it's just so vast. From an AdventHealth standpoint, where are we going? And this is an introduction to our guest today, which is very exciting.
Right. Yeah, John, I appreciate the opportunity for us to actually share all this information with our community. And today, especially, as a resident of Flagler County, I'm extremely excited of the news that we share with our community about the options and the access for mental health that we're bringing to our community. So AdventHealth, a few years ago, we recognized the need. We've been working on a plan. And then COVID came. It kind of made it a little bit more difficult for us to implement some of the plans. But in the meantime, AdventHealth made a great investment in this company called IMPOWER through a grant for $150,000. And that's how we started having conversations with IMPOWER with a goal to bring a mental health clinic to our community. And after a lot of conversations, a lot of planning, we were able to bring this great partner that can offer an online solution to our community, which there's a lot of benefits. I like to tell a lot of people that COVID, if there's a positive thing about COVID, not many, but there's one that we truly learned. We were forced to learn how to do many things online.
That is true.
And healthcare even became easier online because we were forced to adapt and provide these services. So we understand the benefits of having this company giving us an online service.
Well, let's just bring in, we have Amy Blakely. She is the Vice President of Behavioral Health to IMPOWER. Welcome to the Lifeline Show, Amy.
Thank you very much. Good afternoon, gentlemen.
And Amy,
Hello.
You are a very close resident to Flagler County. I believe you're calling in from Volusia County today. So we're all in the same area of the world, which is
That's
great.
Right.
Well, first off, as Wally said, a healthcare clinic to Flagler County. That's exciting for our whole community. But tell our listening audience a little bit about IMPOWER. And that's an IMPOWER, correct?
That is correct. IMPOWER. And we are a not-for-profit company based out of Central Florida. And we provide a lot of services in the behavioral health arena as well as in what we call child well-being. We are affiliated with community-based care organizations, and we work in the child welfare and foster care system quite extensively. We have about 11,000 children and families that we serve in the state of Florida. As you've already mentioned, I oversee the behavioral health portion. So I oversee all of our outpatient psychiatric clinics and our mental health therapy programs, our substance use disorder treatment programs. And I also oversee telehealth. So about 9 years ago, we started utilizing telehealth as an increase to access to care. We were having trouble getting patients served, particularly those that are in provider-impoverished areas. And we started utilizing technology to assist people in getting treatment from the privacy of their own homes. There are so many benefits, and we can talk more about that, but IMPOWER is really famous for that. In fact, we are the leading provider of telehealth behavioral health services in the state of Florida. And as Wally mentioned, COVID has definitely accelerated the use of telehealth. We have been doing it for 9 years now, and we have exceeded 1 million telehealth visits.
It's like having a clinic inside your house available for you, right? So can you tell us a little bit more about the process that our community needs to go through if they feel that IMPOWER can provide the services that they need?
Sure, absolutely. So if you visit our website, which is www.impowerfl.org, so that's www.impowerfl.org, you will see some big buttons on the home screen, and they will ask you, sign myself or my child up for services, or sign someone else up for services. And you can click on either of those buttons and enter information on a patient who is in need of treatment. Then we have a whole team of central referral and scheduling staff who will grab those referrals and reach out to those families or individuals in need and schedule appointments with the appropriate behavioral health practitioner. So there's also a mechanism to get treatment via email. If you send the email to referrals@impowerfl.org, that is also an option. And we try to do an assessment on each person quickly and easily and figure out what type of treatment would best fit their individual needs. So that's the process.
Amy and Wally, if I am in my primary care physician's office and the primary care physician says, I suggest a therapist, he would refer to this cell phone or the email, and then it starts from there.
Correct. We've been working with IMPOWER for the past few weeks to make sure that the information is available for our community physicians.
Right.
The AdventHealth Medical Group already has this information, and they're already starting to refer patients. Our ER, also, the physicians there are actually utilizing this service. And we want to make sure that all the other physicians in our community, employed or not, take advantage of this. It's like having a clinic here in Flagler that we didn't. So now there's absolutely no reason why somebody should not be referred to a clinic for mental health, any of the mental health needs.
That's kind of a game changer. Would you not say that, Amy? You've been in this space for certainly a long time. This telemedicine therapy online on FaceTime would be a game changer in this world, correct?
Correct. And it really is all about accessing treatment. So there aren't enough mental health practitioners logistically to go around. And if there are, sometimes geographically, there are barriers to getting to them. Right. So, for example, you know very well in Flagler County, the challenges of getting to a practitioner's office and the wait list and the drive time and taking time off of work or school to get to appointments. Using telehealth can eliminate and alleviate a lot of those barriers. So we're very excited to be partnering with AdventHealth, and AdventHealth has sought us out because of our use of technology to access care. And as Wally already mentioned, has invested quite a bit with us to partner and really get the word out there so that people in need know that this is an option for them from the privacy of their own home.
Right. And Amy, we were very happy also to learn that, usually there's a wait time when you're referred to a specialist or especially mental health, because it's so hard to find and get in. And in 7 days, you will be talking to a professional. Now, Amy explained that somebody will contact you to get more information and make an assessment, right? That is not what I'm talking about. I'm talking about in 7 days, you could be talking to a psychiatrist. On average, that's how long it's taking, which is extremely fast when you talk about mental health. In about, I would say a year and a half ago, 2 years ago, we were working hard in trying to plan and open a clinic here in Flagler County. So, we would have to get a building. We would have to recruit a physician that's willing to move here. And we actually found a physician, but unfortunately, there was some changes in his personal life, and that didn't work out. But it took a lot of energy, a lot of planning around that. We're now, with IMPOWER, they're able to provide so many different services between medication management, psychiatry, and all other kinds of counseling. And we have multiple access at the convenience of your home and the privacy. And Amy, I know that you can talk more about this, but the fact that it is online, it creates such a component that we don't have to worry about, which is people, hey, I don't want to go walk into that building because people are going to know why I'm going in there. Now you can do it from the privacy of your home. I don't want to take my kid to that doctor because people are going to see me going over there, right?
Yep.
And so there's no way for you to seek help and make sure that you're being treated like any other disease, but you're being treated by a professional. You have easy access.
Correct. And it's really been astounding, first of all, the wait time. Before we had a telehealth program at IMPOWER, our average wait time to get an initial appointment was 10 to 12 weeks. And that's actually the norm, or maybe even a little short of the norm, to have in-person services in the state. And when we switched to the telehealth model, we were able to get individuals in within 2 to 3 days. And right now we're running a 5 to 7 day wait period for individuals to have their very first session with their practitioner. So we're extremely proud of that. And I think I would challenge many other behavioral health care companies to be able to match that. And what's happened is we've been able to now access providers all over the state to see clients all over the state. So we might go to some of the hubs like Miami and Jacksonville, Tampa, Orlando, and hire a lot of practitioners who then can provide services to some of the other areas that don't have the practitioners that they need to meet the needs in their community. Likewise, that allows us to also recruit Spanish-speaking clinicians, Creole-speaking clinicians. And so a lot of those geographical barriers that we once had with that population is now gone because we're able to access these folks online. And just like our clients, all of our practitioners are treating patients from their home office or inside their homes in a HIPAA-compliant area. So it's just very cost efficient, and a lot of practitioners are choosing to do that so they don't have to go anywhere for work anymore. And you can imagine what COVID has done for that process too. But I also wanted to just touch on the stigma component that Wally mentioned, and that is ever so important. I cannot tell you the number of clients who have said to us, if I didn't have an option to get treatment in the evening from my own home, from my own cell phone or tablet, I would not have gotten treatment. And that just is the bottom line, right? So individuals who wouldn't have sought treatment are now receiving treatment, receiving medications, compliant to treatment, and are staying out of hospitals and just generally leading healthier lives, which certainly impacts their families. So that is huge for us, and we've just really been astounded at the younger population, our teens, our youth. Of course, they live on their phones.
Right.
Technology is their world, so they're a lot more comfortable in that setting, disclosing information and really opening up to people as opposed to going to a strange setting and sitting in front of a stranger talking about your innermost feelings.
Right.
One of the goals of our show, Amy, on the subject of mental health is trying to provide our listeners actionable steps if they're having a tough time or feel like they need to do something on the mental health is providing phone numbers and access. So I'm going to repeat the IMPOWERFL.org website that a listener today on Saturday morning can jump on the computer, go to that website, IMPOWER, IMPOWERFL.org, set up a schedule for a session with one of your clinicians or one of your staff to begin the process, correct? They could do that even on a Saturday morning in their PJs at home.
Absolutely. Anytime, absolutely. And we have set up the access to treatment in the way that individuals can sign up for services, they can receive their services, and they can receive their medications delivered to them without ever leaving their own home.
And as y'all and Wally both talk, there's a lot of physician referrals that are coming from the physicians, but a lot of people don't have a primary care physician, but they don't need a referral to gain access to the IMPOWER org and the benefits of therapy online, correct?
Correct. That is correct. And I also want to mention we have received some state funding for managing crisis. And let me talk about that for a moment because that is extremely important in our communities. We have been awarded money for individuals who do not have insurance or are underinsured. If they meet financial qualifications, they are able to get free services. So the treatment is free, and that also includes the cost of their medications. So it can all be free, zero charge to individuals who qualify who are uninsured or underinsured in the state of Florida.
That's amazing.
Children and adults.
That's
amazing.
A tremendous program that not only do we know that there's a need here in Flagler County, but I'm sure you, Amy, see that all over the country and all your areas.
And Amy, I in talking to some of the leadership from IMPOWER, they explained to me that that was extended until May of next year, right? Because this came because of COVID last year, and this grant got extended until May of next year.
Correct. So we received this for this fiscal year, which for us ends June 30th. And then we just found out within the last few weeks that we have also got additional funding. So the funding is being replenished through actually, Wally, the end of June 2022.
All right.
So just repeating that, even for those that have financial constraints on them and we see it every day going to the doctors, of not going to the doctor because of the co-pays or whatever the financial expenses associated with it, that's not a barrier that should keep somebody from logging on and beginning to talk to IMPOWER about their mental health.
Absolutely not. We have the funding for the treatment and for medication.
Yes, and among many of the insurances that IMPOWER accepts, Medicaid is one of them, which is important for us because we have the need in our community. We have many that has Medicaid, and IMPOWER can provide services for those patients as well.
Well, we talk about the older population and the younger population in our next show, and we're hoping, Amy, you can stay with us for our next segment as we're going to bring in Flagler County Schools with us and talk about IMPOWER and the great work you're beginning to do in our Flagler County Schools for our youth. But to talk about a little bit with IMPOWER, you mentioned behavioral, you mentioned substance abuse, you mentioned medication management. I guess each one of those, as your clinicians, they got to specialize in all three of them, or is there you have different clinicians kind of targeted for a behavioral versus a substance?
The latter, absolutely. Oh. So we provide all of those services, and we have practitioners who specialize in each.
Talk about a case manager. I saw one of your flyers, and it had you will be a case manager. In my mind, that means you're going to follow that patient for a long time. It's not a one and done, but you're going to set up a program for your client, so it's a long-term play, not just a 30-minute phone call and you're on your own.
Correct. We have case managers and telehealth support specialists who will help our clients navigate through the system of getting signed up for services, entering any insurance information or qualifying for the free services, and also assist them in how to log in to have their telehealth visit, which is very, very simple. It's a HIPAA-compliant secure link that is sent to an email or a cell phone, and our staff will assist the patients and provide support for them to click into the link and get into their HIPAA-compliant secure appointments. And so a lot of people sometimes feel like they might not have the technology skills or the technology to have their telehealth services done from home, but it's really quite simple, and we provide case managers and telehealth support specialists to assist them in successfully doing that.
Yeah, and there's another component too, John, that it's extremely important, and that's why AdventHealth, we just didn't go into this and say, okay, let's advertise IMPOWER. Our goal is to make sure that physicians are part of this as well, so they can refer patients, and IMPOWER can send the information back to your primary care, because the primary care physician wants to have this information available as he is the quarterback of your healthcare, right?
Yes.
And so it is important that IMPOWER also will be able to communicate and send information back to the physicians. And so our AdventHealth medical group, that's why we worked in terms of not only educating them about this service, but also making sure within our technology that we make it easier for them to refer to a mental health provider, which is in this case is IMPOWER. Which I mean, this is great news. We just made the official announcement a few days ago, and we're excited that AdventHealth is able to bring a solution to Flagler County for mental health in partnering with IMPOWER, such a great company. And we're excited that we're going to be able to make an impact. This is something that needed to be done. We recognize it, and now we can say it's done.
Well, Amy Blakely, I thank you so much for being a part of this show. I hope you can come back on our next show, which will bring Flagler County Schools to the table, and we'll talk about kind of IMPOWER's work with the great youth in our community. And there's a lot of actions going on with the education and our youth staying right here and keeping healthy. Wally, this show has opened my eyes with regards to mental health. This is a true solution-based action step that our community. So for anybody listening, again, log on in the computer, IMPOWER, that's IMPOWERFL.org, and begin talking to IMPOWER as an organization, and we wish you well. Wally, thanks for being here.
Thank you.
Amy, I appreciate it. This is John Subers with Lifeline. Thanks for listening.